You know that feeling when a fall seems to come out of nowhere? A quick slip, a dizzy moment, or just one step that didn't land quite right? Many people think of falls as simple accidents, maybe a loose rug, a slippery tile, or a missed step. But what often goes unnoticed is how much our medications can quietly increase that risk. This isn't about fear or blame, it's about awareness and safer choices. Some medicines that help the heart, relieve pain, or calm the mind can also lower your blood pressure or slow your reflexes just enough to throw you off balance. You don't need to stop any medicine on your own. The key is understanding which ones might affect your alertness, your strength, or your steadiness. Once you know what to look for, you can work with your doctor to stay both safe and independent. Let's talk about why medications can affect balance and the 5 most common kinds that may quietly raise your fall risk. Every medication in your body acts like a tiny messenger. Some calm the brain, others lower blood pressure, some ease pain or lift mood. Those changes can bring comfort, but they also change how your body reacts. A pill that slows racing thoughts can also slow your reflexes. One that relaxes blood vessels can make you dizzy when you stand up too fast. And when you take several medicines together, the side effects can add up, even if each pill seems mild on its own. Doctors call this polypharmacy. It simply means taking many medications at once. It's often necessary, but it can make side effects more likely, especially things like dizziness, fatigue, or slower coordination. That's why it's important to review everything you take. Prescriptions, vitamins, even over-the-counter pills. Each plays a small role in how steady you feel day to day. Now, let's go over the 5 medication types most often linked to falls. First, blood pressure medications. These are vital for your heart and for stroke prevention. But sometimes they work a little too well. If your blood pressure drops quickly, you might feel lightheaded or faint, especially when standing up or getting out of bed. If you notice that head rush when you stand, mention it to your doctor. They can adjust your dose, change timing, or suggest simple steps like drinking more water or rising slowly. It's not about stopping treatment, it's about balance and safety. Second, sleep aids and anxiety medications. These can be helpful for short-term stress or sleepless nights, but they also calm the same brain signals that keep you alert and coordinated. That means slower reaction times, foggy thinking, and sometimes confusion at night when the light is dim. Older adults often feel their effects longer because our bodies clear them more slowly. If you feel groggy in the morning or unsteady at night, ask your doctor about options. Sometimes small changes, like taking the medicine earlier or using shorter acting forms, can make a big difference. And if you can, try natural sleep habits first. A cool, dark room, no caffeine late in the day, and slow breathing before bed. Third, antidepressants. They help balance brain chemistry, but they can also affect blood pressure and coordination. Older versions, like tricyclic antidepressants, often cause blurred vision or dizziness. Newer ones are gentler, but still worth watching closely, especially if you take other sedating medicines. If you feel lightheaded when standing or turning quickly, take note. Don't stop suddenly. Instead, bring it up with your provider. Sometimes taking your dose at night instead of morning helps you feel steadier during the day. Fourth, strong pain medicines or opioids. They can bring much needed relief, but they also slow parts of the nervous system. That means slower reflexes, drowsiness, or mild confusion, even after just a few doses. If you notice yourself moving slower, dropping things, or needing extra support to stand, your dose might be too high. Ask your doctor to review it. Many people do well on smaller doses combined with therapy, gentle stretching, or topical treatments. And fifth, allergy, motion, and cold medicines. Some of these, especially older antihistamines, were designed decades ago and cross into the brain. That's why they make you sleepy or foggy. Newer, non-drowsy options are safer for daytime use, but many people still keep older ones in their medicine cabinet. If you take an allergy pill that makes you drowsy or combine it with a nighttime sleep aid, the effects can multiply. A quick chat with your pharmacist can help you find alternatives that keep symptoms under control without increasing fall risk. When you look at these 5 medication groups together, a pattern appears. The same medicines that relax or calm parts of the body can also slow the balance system just enough to cause trouble when you move quickly, stand, or turn in the dark. But the good news is, almost all of these risks can be managed. You don't need to stop taking important medicines. You just need to stay aware, communicate often, and make small adjustments. Let's talk about how to check your medication list safely. Start by gathering every pill, supplement, or over-the-counter product you use. Lay them out where you can see the labels clearly. Notice words like "may cause dizziness" or "avoid driving." Those are your first clues. Write them down, then bring the list to your next appointment. Even better, ask your pharmacist or doctor to review it once a year. They can spot interactions or overlaps you might not notice. And here's one more helpful step. Pair that medication check with a short balance test at your clinic or physical therapy center. It takes just a few minutes, but it gives a complete picture of your safety and strength. Never skip or cut pills on your own. Changes should always be guided and gradual. That way your body adjusts safely and smoothly. When you finish reviewing your list, you'll feel more confident. You'll know what you're taking, why, and how each medicine fits your goals for health and independence. Good sleep, clear thinking, and steady movement all begin with awareness. Talk openly with your doctor and pharmacist. Ask whether any of your current medications could affect your balance, and if small timing or dosage changes might help. Falls often start with small moments of dizziness or slowed reaction. Understanding which medicines contribute helps you stay a step ahead. You've got this. If this helped you understand your medications better, please comment below, subscribe, and share it with a friend who takes daily prescriptions.